Welcome friends to our NPTEL MOOC module on health economics. This is our 11th week and we have targeted to discuss health issues in terms of their data, what different sources of data are available and what are the indicators, and how as a researcher one should search and include in his or her work. So, we will discuss in the first two lecture, we will emphasize on the micro and macro sources and indicators of data. Then on the third, we will attempt to discuss on the basic analysis using basic models. Then the later two will be emphasizing on the softwares, the packages where we can able to answer how it is available, etc. So, here we will emphasize on sources of data. Before that, let me recapitulate what we did in our previous week. We discussed on concept of efficiency. We also discussed different aspects of data and implement analysis. So, this lecture briefly introduce you about data in healthcare, their sources, indicators and challenges in data collection. Starting with the background, health economists usually face the questions which requires indeed the correlations between variables under examination for the analysis. So, the obvious aspect is how to delve into the economic relationship and specifying the models, econometrics model, which requires data. The sequence is like understanding the investigation of economic relationships that requires specification of economic model, then further it requires understanding of data. All these helps in specification of appropriate model and choice of estimation method. So, much of the work of health economists relies on the type of data available, which is usually divided into our observational study data and administrative data. So, in this lecture we will be emphasizing on observational studies data. Thus, largely explain the micro foundations or the micro informations at a very disaggregated settings from the perspective of individuals. However, these can be used for macro analysis when employed at an aggregate level. I mean, collating the micro will generate the macro aggregates, often designed to provide data on a representative sample of the underlying population. These may include both quantitative and qualitative data. Whereas the administrative data includes micro and macro as well, aspects as well. These are not designed primarily for research purposes. These may include only quantitative data. Understanding the observational studies data, it is broadly of two types. One is at primary level, another is secondary. Primary again is of two types, one is qualitative and quantitative, and secondary it is quantitative in nature. Then so far as qualitative primary data is concerned, since we said these are observational, these can be collected through interviews, FGDs, that is called focus group discussions, observation case studies, etc. Then quantitative data covered through survey or collecting both objective and subjective measures or through experiments. Whereas in case of secondary and that is quantitative one, we usually base on the large scale unit level surveys that is usually carried out by research institutions with the help of government. So, let us elaborate on each of these little more and we will emphasize further on what is called qualitative. As I already discussed, these include interviews within the qualitative framework and these are mostly unstructured, which also allows flexibility. However, they can also be semi-structured or structured based on research needs. Subjective health assessment and or exploring patient experience, etc. are some of the examples of qualitative information from the interviews. Then second one is focus group discussion, that consist of the focused persons, especially the stakeholders who are bearing the context upon which the study is based on, and this usually considered to be a limited set of group, and used to be catering to their locality or to their surrounding, and they must be in a very closed compact group of interchanging ideas and discussions. So, group discussion where a facilitator always is needed, and the facilitator leads to a discussion on a specific topic followed by participants sharing their experience. For example, doctors' perception of a newly introduced health service should be discussed through a focus group discussion approach. Another is called ethnographic observation. This involves observing and recording behavior or interactions of an individual or a group in a particular setting. For example, exploring how different tribes use traditional medicines to improve their health issues. Another one is the qualitative micro or the observational data is through case studies. This involves in-depth analysis of a phenomena of a particular individual, group or organizations, usually over an extended period. For example, analyzing COVID impact on a particular group can be considered to be a case study. So, next is the quantitative but primary one. Primary data is through surveys. In quantitative research, surveys are used to collect data from sample of individuals using a standardized questionnaire method. Roberts et al. 2019 used surveys to collect data on quality of care delivery and the uptake of evidence-based practices. To note that many health surveys now includes objective measurement of health as part of clinical research assessment along with the subjective health assessment, which alone might give inaccurate results. Another approach of quantitative information is called experiments. In health economics, experimental research is used to evaluate the effectiveness of an intervention. That is, a clinical trial is a type of experiment that tests the safety and efficacy of a new drug or medical device. Another example can be the randomized control trial, which is very popular in the recent time, which we have also referred in our second week on RAND experiment. One thing to note here that since RCTs, randomized control trial, are very expensive, time consuming and are not always practical or ethical, economists sought quasi or natural experiment that exploit variation in any variable across time and space to analyze the relations. For example, Grossman in 2015 work analyzed the causal impact of change in education on health. Secondary data, as I already mentioned, that it is usually the large scale unit level data sets collected by academician or by research institutions or the government of India with the all possible aspects including its ethical clearance, etc. So, unit level data refers to detailed data with respect to sampled unit at the ultimate stage along with the sampling weight for that stage. As we have also discussed this aspect in my lecture on handling large scale data. If you search in YouTube, you will also find these things on handling large scale survey data. So, and especially the emphasis was on weight. Weight will represent the state or district, so that the findings from the data you can able to claim as representing to the entire area. It is also called the micro data or disaggregated data or even the raw data. It depends on where you are actually working. I will discuss. Usually this involves first stage, second stage and third stage. So, usually the final stage, the the final stage is considered to be the households. Okay, how households are actually considered as the surveying unit in NSS data. So, TSUs, SSU, FSUs, etc. These are the words used in the survey data which we discuss in this module. There are advantages of unit level data. As I just said, these are national representative, not just national representative, these are also, it depends upon the survey. But nowadays all the survey conducted by Government of India or the bigger institutions, usually they represent the data at national level, state level and district level. Okay, so accordingly the different weights are given. Sometimes you might require I weight, sometimes you require P weight, sometimes you require A weight, analytical weight, etc. So, we have discussed something on this in another module on survey data on healthcare. So, I am not discussing much here because our focus is on understanding the concepts of health economics. Let us understand further details of or the advantages of unit level data. This provide information about characteristics of individual or entries such as household, business enterprises, facilities, firms or even geographical areas such as villages or towns. This allows in-depth understanding of socio-economic issues by studying relationship and interactions among phenomena. This is key to designing projects and formulating policies, targeting intervention and monitoring and measuring the impact is very becoming very helpful from these data sets. Now, I am citing and referring you directly the sources of the unit level data sets in India. Its sources, how you should work on it, one by one we are mentioning. This is National Sample Survey, this is National Family Health Survey. So, NSS is here, then this is Consumer Pyramid, this is LASI, Longitudinal Aging Survey of India, and this is India's Human Development Survey, and this is SAGE database on healthcare, and this is Young Life Survey, okay, especially useful for cohort, etc. I will emphasize now. So, first aspect is understanding the richness of the data, where you get the in-depths. So far as the coverage is concerned, just the coverage, I think the NSS National Sample Survey data and NFHS are considered to be the best even across the globe. Yes, one of the advantages of being huge population in this country, and that too Government of India had a long plan in covering a large scale survey. These two, especially NSS, is considered to be one of the best in the world, especially its design, etc. So far as NFHS is concerned, it has already covered 5 rounds. Okay. So, 5 rounds have already been covered. So, starting from 1992, the latest round is NFHS 5. If you click on this website, you will be redirected to the site. We have given all the links. I will just tell you, let me explain a bit. Otherwise, let me open this first. National Family Health Survey, from the word itself you can understand the focus is on family and their health, and the major focus is on women issues, okay, women and child. The questionnaire, the latest round that was covered is 2019 till 21. This is the latest round. This is called NFHS 5. Okay, if you click on this link, all the databases are available. You need to do a simple registration with your college iCard. So, it will give you the data, and the portal is DHS datasets. If you click on this, if I just click on, it will direct me to that site. I am just going to open it and let you know how it works. Here is the datasets, and datasets are in fact available in different categories. Just see once, when I say that it is on Beeman, actually in FHS if you read that correctly, it is here individual recode data. Individual recode is the word they have written only to explain you or to help you out in the data set in terms of its categories. These are systematically presented. That does not mean they have actually diluted the raw data. Either you can directly get the raw data and cross check whether it is right or not, or you can directly get the data in Stata format or in SAS format, in SPSS format. So, individual record refers to the Beeman profile. Then children, recode, etc., all data sets are available here. And this refers to the latest 2019-21 data set. Other data set you can just click here, then filter with the data here, then you just register it, and then you click on the country which country you actually require, then you will be, or you need to first register and then the country etc., it will be actually visible on your page on your desk. So, upon registration all the links will be activated and you can able to download. So, this is one. Then second aspect I need to emphasize on the NSS. NSS, as I already mentioned, that we have dedicated modules of my own. There are 2 modules which are successfully running in NPTEL platform. One is on handling large scale data, another one is on survey data on healthcare. So, anyway, my focus was on health, so I did not record any other, but however, you can get all the sources over here. Okay, so, if you just click over here, it is directed as the latest round of data set on health in the 75th round of National Sample Survey conducted in the year 2017 to 2018 for over 1 year. And all those things are important, this complete need to download the report, then its data layout, then its readme file, then other schedules. Okay, schedule 25.0 is input. The schedule means it is the questionnaire. Then you need to get the raw data from here, raw data in different format. You have to click over here, get micro data. So, it asks for a registration, then it will be directed to the page of the to download the data. However, there are other data sets also which NSS provides on agriculture, on debt and investment, okay, then on labor issues, employment on employment round, or and latest one is PLFS, periodic labor force survey. Then it also provides information about time use survey, TUS. Okay, so time use survey. Besides this, you also get consumer expenditure rounds as well. These rounds are very interesting and very relevant for the researchers to publish their paper in journals and newspaper, wherever you want. I think further guidance are available in our module in the YouTube. If you search with large scale data, NSS etc., it will be directed to our page. Okay, so now I am not focusing on this. This is purely cross sectional data sets. Others are important. I am just highlighting with green border that emphasizes longitudinal nature of the data. Longitudinal means the data is provided or it surveyed over different time period with the repetition of the households, and these are also called panel data. And another interesting aspect of the survey, somewhere you can also track like young life survey, it is also panel data, also specifically called it is a cohort data. The cohort group is actually emphasized in other rounds, like a age group of these after 5 years it would have added with another 5 years. So, the other 5 years are actually covered in another round. Okay, the same cohort, like today right now suppose I am around 40. So, if the survey is conducted after 2 years, I would have been 42. So, the person with me, the age group is covered as 42. So, I am also included there, but the cohort is emphasized. So, there have been a series of 5 cohort series so far, by the young lives. Okay, hence it is called cohort. It also called a panel, but specifically called cohort data. And coming to the interesting data through ISDS, it emphasizes on the human developmental issues such as education, health, income, etc. So you can also this track gives information about crime records. It gives about education and the cognitive level of the children. And but one of the demerit is that the latest round was in 2011-12, so this is relatively older. However, since this represents the area or the district and the state and India in particular, hence these data sets are also useful. Besides this, consumer pyramid is also well referred is through the CMI. All the links are given. I am not going to open at this moment. ISDS has 2 rounds. I probably missed this. But consumer pyramids is claiming to be the biggest longitudinal data. It has covered so many rounds. You will get interesting aspects on consumer expenditure, even on health issues as well. There are 27 rounds of these consumer issues. You can follow it from the site of CMI. Another one is called LASI, Longitudinal Aging Survey of India. The focus here is on aging, aged population 45 years onwards. So, some more should also be referred. Another aspect is for SAGE data set of WHO. It has a focus on the health systems. Okay. So, will be useful. Some work you can also refer from World Bank, especially it is also at a micro level. It represents 6 states, selected districts, and the impact of COVID, etc., can also be derived from this World Bank micro data. If you search or click on this link, you will be directed to that page. So, given the time paucity, I am not explaining. I am happy to guide you in our live sessions. Besides that, the indicator derived from observational studies data includes mortality, morbidity rates, healthcare utilizations, and their related expenditures, disease prevalence. Like within mortality, we will have a complete coverage on non-communicable diseases, biomarkers, cell passes health. It has a focus on different parameters of morbidities and public health surveillance, how far these also help in calculating morbidity, mortality rates, etc. Coming to healthcare utilization and their related expenditure, you will get enough information about out-of-pocket expenditure. These include hospital visits, outpatient care, preventive services and cost, etc. Disease prevalence can also be tracked from those observational studies. Okay, I think you can follow from the slides. However, there are challenges involved in the observational data collection, such as data privacy and confidentiality. Observational studies, data collection and usage must adhere to strict privacy regulations to safeguard individual information and maintain confidentiality. Data quality and completeness related questions are often raised. Challenges of course arise ensuring the accuracy, completeness and consistency. Hence, how far it is creating some challenge in terms of the validity and reliability. It is up to the researcher to give or add tools and techniques to validate. Further, it has resource constraints, which is a bigger challenge to have a better coverage of the survey. So, what we are actually heading for the next lecture, it is on data in healthcare, especially focus is on administrative data sources. In order to study it further, we have given you the link here, from our model exploring survey data on healthcare. You can follow this link. Even the YouTube platforms and these links are given for you. Rest, if you want to have some clarification on how the survey data are used and codes, etc., are used, you can refer to other articles which you have cited here. Okay, so these are all at this moment. I hope it will be helpful. Thank you. I should stop here. Thank you.